She told me she stopped drinking water after 6 p.m. Seemed reasonable, she said. She was 71 years old, a retired nurse, sharp as anyone I've ever met. She had a stroke at 2:43 in the morning. Her blood was the consistency of cold maple syrup. My name is Dr. Robert Caldwell, a cardiothoracic surgeon. Today I want to talk about a powerful cardiovascular protective decision a person over 60 can make every day. I'm talking about water. Specifically, what happens to your blood and brain when you don't drink enough of it. Your body loses fluid continuously between 10 p.m. and 7 a.m., and most people do nothing to replace it. This is the biological explanation of what happens inside your cerebral arteries at 2 a.m. when you skip that glass. The Adventist Health Study followed 20,000 adults. The results? A 54% lower risk of fatal heart disease for men, and a 41% lower risk for women, not from a statin or surgery, but from your kitchen tap. It costs nothing, no prescription needed, it's just water, and it could save your life. The blood viscosity that the water prevents. Your blood is not a fixed substance. Its physical properties, specifically how thick it is, how easily it flows, how likely it is to form clots, change throughout the day based on hydration status. When you are well hydrated, blood moves freely through your vessels. Red blood cells flow efficiently. Plasma, the liquid component of blood, is thin enough to carry everything where it needs to go without significant resistance. When you are dehydrated, the plasma volume decreases. The ratio of blood cells to plasma increases. Your blood becomes concentrated, thicker. The Edinburgh Artery Study, following 1,592 men and women aged 55 to 74 for 5 years, tracking 272 cardiovascular events, found that blood viscosity was independently associated with stroke and cardiovascular disease at least as strongly as conventional risk factors including smoking, diastolic blood pressure, and LDL cholesterol. Let me say that again. Blood thickness, driven significantly by hydration status, was as powerful a cardiovascular predictor as smoking status, and almost nobody talks about it in a routine medical appointment. Now let me explain the specific mechanism that killed the woman I told you about. The one who stopped drinking water at 6 p.m. During the night, your body continues losing fluid. You breathe out moisture with every breath, approximately 300 to 400 mils of fluid per night through respiration alone. Your skin loses fluid through imperceptible sweating. Your kidneys continue producing urine even at minimal flow rates. By the time you have been asleep for 5 or 6 hours, your body may have lost 600 to 900 milliliters of fluid, roughly the equivalent of 2 to 3 glasses of water, without you taking a single step or breaking a sweat. In a 30-year-old with robust kidney function and an efficient thirst response, this overnight fluid loss is managed smoothly. The body compensates. The thirst signal fires when you wake, you drink, and balance is restored quickly. In a body over 60, that same process is profoundly different. Research published in multiple peer-reviewed studies has shown that the thirst mechanism weakens significantly with age. Older adults have a higher osmotic threshold before thirst is triggered, meaning their blood can become measurably more concentrated before the body sends the signal to drink. This means that a 70-year-old may be meaningfully dehydrated without feeling thirsty. And if they stop drinking water at 6 p.m. the previous evening because they didn't want to wake up at 2 a.m. to use the bathroom, they may enter that night already on the low end of hydration and spend 6 to 8 hours losing additional fluid with no compensatory intake. By 2 in the morning, that person's blood viscosity has climbed measurably above its daytime level. The plasma is thinner on fluid. The red blood cells are slightly more concentrated. Fibrinogen, the clotting protein that is one of the independent markers of cardiovascular risk identified in the Edinburgh Artery Study, rises as blood becomes more concentrated. And here is where the 2 a.m. timing becomes critical. Because 2 a.m. is not just any hour of the night for the cardiovascular system. Research consistently shows that heart attacks and strokes cluster in the early morning hours, from roughly 2 a.m. through 9 a.m., and peak in the 2 hours after waking. The reasons for this clustering are multiple and overlapping. Blood pressure begins its pre-dawn rise around 3 to 4 a.m. as cortisol starts to build. Platelet aggregability, the tendency of blood to clot, reaches its circadian peak in the early morning. And plasminogen activator inhibitor 1, the body's clot-dissolving suppressor, reaches its own peak concentration at approximately 6:30 a.m., according to research demonstrating a robust circadian rhythm in this factor. But here is the specific contribution of dehydration to that pre-dawn danger window. A study published in the Journal of Neurosciences, specifically examining wake-up stroke, ischemic stroke occurring during sleep, found that dehydration increases blood viscosity and triggers thrombogenesis, and that higher blood viscosity was significantly associated with wake-up stroke in elderly patients. The mechanism is direct. Thicker blood moving through cerebral arteries that are already narrowed by years of atherosclerosis is more likely to form a clot that occludes the vessel completely. The researchers found the association was particularly strong in two groups: elderly patients, specifically those over 65, and strokes of the small vessel occlusion subtype, the kind that results from a tiny clot blocking a tiny cerebral artery, the kind that most commonly occurs silently, during sleep, without any dramatic warning symptom, the kind that produces the patient who wakes up and their face is dropped on one side, or their arm won't respond, or their words come out scrambled. And a 2025 study in the Journal of Stroke and Cerebrovascular Diseases, analyzing a database of over 3 million adults aged 80 and older using propensity risk matching, confirmed a strong association between dehydration and stroke across multiple stroke subtypes, including ischemic stroke and TIA. Both physiologic changes of normal aging and medications used to treat cardiovascular stroke risk factors increase older adults' risk for dehydration. Diuretics, ACE inhibitors, beta blockers. The medications prescribed to protect the heart and blood pressure can simultaneously promote dehydration, and few patients are told to compensate by increasing their fluid intake to match. Half of all stroke patients admitted to hospital arrive in a dehydrated state, not a coincidence. A mechanism, one that has been visible in clinical data for years and almost never becomes part of the conversation when a doctor hands someone a blood pressure prescription and sends them home. Now let me be precise about something that I know some of you are already thinking. You stop drinking water at 6 p.m. because getting up at 2 a.m. is uncomfortable, because the bathroom trip disrupts your sleep, because the fall risk at 2 a.m. in the dark is real, and for adults over 65, a nighttime fall is no small thing. I understand that completely. I am not dismissing it. But here is the biological reality. The choice between a nighttime bathroom trip and a nighttime stroke is not actually a close call. And the good news is that the choice doesn't have to be that binary. The solution is not to drink enormous quantities of water before bed. The solution is to distribute your fluid intake throughout the day so that by 8 or 9 p.m., your body is already well hydrated, and a single moderate glass of water before bed is all you need to maintain that hydration through the overnight hours. Most people over 60 don't drink enough water during the day. The 2024 NHANES data confirmed that habitually low fluid consumption is extremely common among community-dwelling older adults. A multi-country analysis found that approximately 50% of older adults across 13 countries did not meet recommended fluid intake levels. 50%. Not a fringe group. Half. The fix is not complex, but it requires intention. Start your day with a full glass of water before coffee. Encouraging drink a glass with each meal. Keep a glass visible on your desk, on your counter, somewhere in your sightline during the day, because the aging thirst mechanism will not reliably remind you to drink. You have to build the habit around the cue, not around the sensation of thirst. By 8 p.m., if you have been well hydrated throughout the day, your blood viscosity is already at a healthy level. A single 8-ounce glass of water before bed is not going to send you to the bathroom at 2 a.m. What sends people to the bathroom at 2 a.m. is drinking their first real fluid intake of the day after dinner, because their body has been running on insufficient fluid all day and is trying to compensate all at once. Place a glass of water on your nightstand, not because I want you to wake up to drink it, because if you do wake at 2 a.m. with that mild thirst sensation, the one that aging has made you unlikely to notice during the day, that glass means you drink immediately, without getting out of bed, without turning on a light, without any fall risk. You drink, you lie back down, and you have just reduced the viscosity of your blood at the most dangerous cardiovascular hour of the night. That glass costs nothing, takes 5 seconds to place there, and represents one of the most direct cardiovascular protective actions available to any person over 60, grounded not in complex pharmacology, but in basic hematology. I want to close with a fact that has stayed with me since I first read the Adventist Health Study data. Men who drank 5 or more glasses of water per day had roughly the same reduction in fatal heart disease risk as quitting smoking. Not an exaggeration. That is what the data showed. The viscosity mechanism is that powerful. Think about how much we talk about smoking cessation. Think about the resources devoted to it, the medications, the counseling, the public health campaigns. And then think about the fact that adequate daily hydration appears to carry a comparable reduction in coronary death risk. And the conversation almost never happens. Dehydration in an older adult is not a minor inconvenience to be managed with a little extra coffee or juice. It is a direct contributor to blood viscosity, thrombogenesis, and the specific biological environment in which wake-up strokes occur. Every night, in millions of people who are currently going to bed mildly or significantly dehydrated. People who have never been told that what's in that glass on their nightstand, or what isn't, is part of their cardiovascular protection plan. You now know. And what you do with that knowledge starts tonight. Look, I'm a surgeon, but I'm not your doctor. Everything I've shared today is grounded in published cardiovascular, stroke, and hydration research. Before making any changes to your medication or daily routine, especially if you have heart failure or kidney disease where fluid intake must be carefully managed, talk to your own physician first. What I want is for you to bring this information to that conversation. Because a glass of water before bed, distributed hydration throughout the day, and a glass on your nightstand are not medical interventions requiring a prescription. They are habits. And for a person over 60, they may be among the most quietly powerful cardiovascular decisions they make every single night. Take care of that heart, and take care of the blood it's trying to push through your arteries at 2 in the morning. Give it what it needs to flow. I want to come back to the woman I opened with, the retired nurse, the one who had a stroke at 2:43 in the morning. She survived. Her recovery was long and incomplete, as stroke recovery so often is. When I sat with her afterward, she asked me one thing. She said, "Was it the water?" I told her I couldn't say for certain that it was the water alone. I told her what I'm telling you now, that dehydration elevates blood viscosity, that blood viscosity is an independent risk factor for stroke, and that the early morning hours are the highest risk cardiovascular window, and that the overnight dehydration that comes from stopping fluids after dinner creates exactly the conditions in which wake-up stroke is most likely to occur. She was quiet for a long time. Then she said, "I have a glass on my nightstand now. That is all I wanted. That glass. On the nightstand. Every night." For every person over 60 who watches this and understands what it represents. Not magic, not medication, just the most basic element of cardiovascular biology, fluid, restored to its rightful place in a simple nightly habit that protects the blood you're depending on to keep your brain alive at 2 a.m.